Good day, my fellow students or my dear students. I can refer to you as my fellow students because I've been here before you. I've just refused to graduate. You are welcome and happy Easter Sunday. I hope you are all celebrating well. You are welcome to lecture number 8. The topic is inhibitors and physiologic functions of the cytochrome P450. The course code is BCH 407. Before we proceed, let us have a recap of our previous lecture, that is cytochrome P450, where we talked of the nomenclature of cytochrome P450, the multiple forms of cytochrome P450 by way of the isomers or isomerism, the electron transport system, and the electron transport pathways. We refer to mitochondrial pathway as well as the microsomal pathway. And then the key principles of electron transport was mentioned. We also considered the microsomal versus the mitochondrial electron transport system. Then we saw the overall reaction of the cytochrome P450. Then we also mentioned the cytochrome P450 activity and drug metabolism for the last video lecture. So today's topic is we are going to dwell on inhibitors and physiologic function of cytochrome P450. Now the learning objective for this particular lecture will be as follows. At the end of the lecture, you are expected to have the ability to define cytochrome P450, describe its physiological functions in the body, explain different types of cytochrome P450 inhibition, identify common cytochrome P450 inhibitors and their relevance, as well as be able to relate cytochrome P450 inhibition to drug interaction and toxicity. That's so much for the learning objectives. Now, by way of introduction, recall that we have earlier defined cytochrome P450 as superfamily of heme containing monooxygenases located in the liver and the intestine. The particular site in the liver is the smooth endoplasmic reticulum, and we also have some activity of the cytochrome P450 enzyme in the lungs, the kidneys, and the intestines. And of course, it uses NADPH in addition to oxygen to oxidize substrates. And I recall giving you the general or overall equation for the reaction. The major isoenzymes include the following: CYP3A4, CYP2D6, CYP2C9, CYP1A2, with CYP3A4 being the most abundant of the enzyme. Now let's proceed and look at the cytochrome P450 physiological functions. As mentioned from the beginning, they are involved in drug metabolism or biotransformation of drugs. You can see the pathway involving the phase 1 and the phase 2 reactions. Essentially, the phase 1 is involved in oxidation, reduction, and hydrolysis, where lipophilic drugs are converted to hydrophilic metabolites. Then, if not sufficiently soluble, it will proceed to phase 2 reaction for conjugation. The reason for the conjugation is for further solubility for easy excretion from the body. Now, another function of cytochrome P450 is in steroid hormone synthesis. Steroid hormone synthesis commenced with cholesterol, excuse me. They are involved in the synthesis of cortisol, aldosterone, testosterone, and estrogen. Now you can see the pathway leading to each of the products. In addition to synthesis of hormone, drug metabolism, the cytochrome P450 are also involved in the metabolism of endogenous compounds such as fatty acid, prostaglandins, the bile acid, and the vitamin D activation. The detoxification reactions include environmental toxins, carcinogens, and pollutants. Of course, they are also involved in reactive oxygen species formation, which generates reactive oxygen species. They are involved in reactions, cellular reactions that are involved in the generation of reactive oxygen species as byproducts. These are important in oxidative stress and cellular toxicity. We now go straight to look at inhibitors of cytochrome P450. As defined earlier, these inhibitors are substances that can reduce the cytochrome P450 enzyme activity, leading to decreased drug metabolism or increased plasma drug concentrations, which are in fact undesirable to the system. Of course, from our previous knowledge in biochemistry, there are different types of inhibition, of enzyme inhibition. We have competitive inhibition, where enzymes compete with substrates for active sites. We have reversible inhibition, where the enzyme binds to the inhibitor, and that reaction can also or is reversible. You are familiar with this from BCH 301 of our general biochemistry. We have non-specific or not competitive inhibition. This is where enzyme binds to the substrate at different sites. Now, this reduces enzyme activity regardless of substrate concentration. Now, there is also the mechanism-based inhibition, which is often referred to as the suicide inhibition. This is irreversible in nature, whereby enzyme is permanently inactivated and requires a new enzyme synthesis when such enzyme action is required. Now let's quickly look at factors affecting cytochrome P450 inhibition. We have genetic polymorphism, we have age, we have liver enzyme or liver disease, we have diets and environmental chemicals. Excuse me. These are factors that can affect cytochrome P450 enzyme inhibition. Please, you excuse me. You can see that I'm yawning. I'm recording this lecture at 15 minutes past 2 a.m. So you can bear with me. The body is calling for a rest. Now, this is the reference material, and it is recommended for you to help you gain more insight into the topics we have taught so far and the ones we are yet to deal with. So, what have we learned? What is the takeaway from this seemingly simple discussion? We just noted that the cytochrome P4 enzymes are central to drug metabolism, hormone biosynthesis, detoxification reaction, and of course, it is also important in inhibition reactions where it leads to reduced metabolism, increased drug levels, and potential toxicity. Now, in essence, understanding cytochrome P450 inhibition is critical in pharmacology, drug design, and potential and personalized medicine. With this, I hope you have grasped one or two information about the topic, physiological functions, inhibitors, and physiological functions of cytochrome P450. I cannot leave you without this teaser, which I often title Study Question. Now read the questions and try to attempt them. They will help you to assess your own understanding of what is presented. If you sincerely and faithfully attempt to answer the question, you will be able to rightfully assess your level of understanding. This is the end of the lecture. Thank you for listening and for being awake like me. Have a nice day.